Next, for our third talk and last, we'll have Daniela and João. They both work in Tonic. Daniela has more than 20 years of experience. She holds a PhD in neuroscience with collaboration with the Oxford University and also an executive MBA. Her career spans from clinical practice, medical leadership, academia, pharmaceutical, and so on. But for me, what shows how incredible she is that she began coding at the age of 9. Then she will be doing our talk with João, which is an engineer with over 15 years of experience developing data-driven solutions. He co-founded Innovertel, I hope I didn't mispronounce this, later acquired by Sonai. He's also an angel, a business investor, and he managed a partner in Civic Capital and also connected to the scientific community. So this is our last talk. Come to the stage. The floor is yours.
So, hi, I only vibe code these days, so don't. No, let me present what we are doing. So the idea of this talk is to show you what we are developing at Tonic Easy Medical, but especially also to give you a sneak peek of what is behind what we are building. I think it's super interesting today to have like a more hands-on view. So I'll start our presentation and João will follow with a more technical part. So of course, GenAI is here to stay. And what we believe is that at this point in time, we are actually underestimating the impact of this technology in our lives. It's already pervasive, as we can see, and actually mixing up with other technologies that are also widely available and generalist, paired up with reducing of the costs of some important like hardware and all of this together is actually creating this impressive wave and fast wave that we've never seen. So in medicine, AI already exists for many, many years in areas such as imaging. I actually am a neuroradiologist by training. So we've been using AI already like in image acquisition, image processing, and these days already in assisting in diagnosis. But of course, different techniques from Gen AI, but also these older techniques together with these newer techniques are revolutionizing other areas of medicine, not only imaging, but as well like patient-doctor relationship, drug discovery, and so much more. So the technology, like the software using Gen AI technology that is most common these days are like what we call the scribes. So these are basically note takers that assist physicians in transcribing the appointment with the patient, and that they assist in taking the clinical notes and integrating the clinical notes with the reminder software that the doctor is using. So this is what is like most common right now, and that's where GenAI started in like more admin processes, even though these days the transcribers are a class 1 medical device already, because if they make a mistake in transcribing some important detail of the conversation, a doctor may make a mistake afterwards. But also what we are seeing in this wave in medicine is that big tech is entering way sooner than they entered in the medical field in other like moments in time. So the first note takers, the first scribes appear in the market, and in just a few months, for example, Microsoft launched a Microsoft Dragon, which is their own note taker. And because most hospitals are already using Microsoft products, this is a very, very easy sell for them. So they already have like 45% or so of the global market. So coming from a small company like Tonic Easy Medical, of course, compared with the previous mentioned company, we thought, well, we want to create an AI tool that supports physicians, clinical copilot, but how are we going to differentiate our copilot from like the existing capabilities of generalist AIs like ChatGPT or Gemini? So from inception, we decided, okay, we can play, but we need to play it in a very smart way, or else it's only a few months also until we're eaten. So we decided to go the hardest route. So play in Europe, which is, as you know, not a single region in terms of market, not as the way we'd like it to be. We decided to go clinical, so this means stronger regulations for us. And we decided to adapt, not like totally, but at least some extent to each market. So we decided, like, if we do this, we are basically personalizing our AI for the physicians of certain markets, making others more difficult to play. So when we decided to develop the Copilot in like October 2023, we already had our medical platform, which was already an advantage because we had at least partially the distribution guaranteed. So we've developed the Copilot, we've integrated it in the existing platform that has other resources, and that's how we've did the first distribution. So to the existing medical community. So right now we have roughly 180,000 medical doctors. We are doing EU5. We started from Portugal, which is our test market, and we are now present in France, Spain, Italy, being Italy our fastest growing market, and we are now preparing UK and German entry that we've postponed to focus on the AI strategy. And I think it was quite well done because now we're going to enter these two big markets in a much stronger way. But this is my favorite slide actually, because this slide tells the story of our product since pre-pandemic. So I'll try to follow here my lead. So before the pandemic, and we're looking at data from the first quarter of 2020, the way medical doctors behaved was really, really predictable. So they will always consume the same kind of content and tools. Even we knew like which months the engagement dropped, which months the engagement was higher, which tools they use at which time. Then of course the pandemic came, and you're watching here in this graph, like our resources organized by main categories. When the pandemic started, of course, we had to support them very quickly with COVID information, at first thing. But afterwards, we saw something happen. So if you follow the light green bar, you'll see that our jobs section, section where we basically post job opportunities for doctors, increased significantly in engagement. Doctors were tired, they were angry. They wanted a change. All specialties, all countries, the same phenomenon happened. Then we knew that this was kind of artificial, right? Having such engagement in the job section, and of course also COVID content consumption. And we were already preparing for so how are we going to replace this engagement, because we're invested by VCs, and actually things need to keep improving, even if it's contextual. So something else happened. The war in Ukraine started. And from one day to the other, the consumption of COVID content and of the jobs section dropped 75%. So what we thought would be a gradual slowdown, it was quite sudden. So we were like, uh-oh, now we have a problem. Houston, we have a problem. And the story goes like this, and you'll see like the dark green bar that basically really replaced the light green bar, which is the educational content and games section. The keyword is games. We needed a new resource in our platform that was not use case dependent like clinical resources, because with clinical resources, we cannot push engagement because it depends if the doctor has this or that problem in front of him or her. So we needed something that would be independent from clinical practice, but still fit the clinical platform, And I remember that day very well because I was ready to go to catch some flights with my luggage in the office. And at the time, my PA came to me, Daniela, I had one idea. Paulo, what is it? What if we added the game section for doctors, like medical quizzes or a Wordle for doctors? Paulo, this is a great idea. Just go get João, our CTO, tell him your idea and let's do it. And so the team, like in 2 weeks, made a games section. It was actually a medical Wordle. And this basically replaced the engagement while we were adapting. And of course, when it got to 2023, we thought like, okay, yeah, if either we start using Gen AI or we'll be cannibalized, it's impossible not to. So that's why we decided to create the clinical copilot. So it was a pivot we did. And as you can see, now we're talking about the purple bar. The move was spectacular. I think that we may be probably dead if we didn't act so fast this time, again, actually. And actually, the AI Copilot is growing exponentially in engagement and driving exponential growth overall of our platform. So what are doctors doing in our AI? Very high level, roughly 25% of the interactions is to support diagnosis. Around 18% is to support pharmacological treatment decision-making. Then we have another breakdown with admin questions, science, and so forth. Finally, I'd like to finish my part before João starts with a more technical and governance bit. To just share with you, because I'm also a medical doctor by training, like the results of a survey we did some time ago to our physician community. So we asked, among other questions, which was like what worried them the most regarding the introduction, like the massive introduction of AI in medicine. And across specialties, across age groups, by far it was, they believe that there is a risk of dehumanizing medicine. So I would like to share that with you. Okay, João.
Let's see if this is working. Okay, so moving now to the part of actually how it has been being on the other side of actually building AI products, especially since the Gen AI explosion of the last 2 years. So I've been doing machine learning for many years, and I believe that not even that prepared me for what happened over the last, I would say, three years in terms of speed. And I'm going to share with you some of the challenges, a few of the insights of what we learned so far. And I'm going to start with one of those that is something that we really don't have it entirely grasped, but it's something that I think that we are starting to cope with. So everything is moving too fast. So everyone is feeling that is in this space that every week, every day, we have new things coming out, new models. So keeping up with speed is one of the key challenges. But as we are in the healthcare space, we have another key challenge, which is if you go too fast, then you cannot be safe, you cannot be compliant, and there is some type of trade-off, some type of balance that we need to manage in order for us to be able actually to go fast, to keep up with the trend, to have value for our users. And as Daniel was saying, at the end of the day, all our competitors in AI are big tech, are OpenAI and Gemini and so on. So we need to make sure that we stay relevant, that we stay differentiated from in our space, with our community, in what we are doing. So from the beginning, we actually started thinking, okay, we need to go fast, but we are in medicine, and we know that not everything applies the same way here. So safety is a key thing that we need to account for. And based on that, we've been designing some strategies on how to cope with this. I would say that actually in the title we have like an internal joke that we usually use, is that even within this, most of the process that we have within the company don't really apply to AI. So as most companies, you can imagine, we have like roadmaps, discussions that we decide we're going to do for the next 6 months, 12 months. And I would say that for the last year, AI roadmap is the one that has the least survival period. Usually after 2-3 months tops, it dies. At the beginning, we were getting worried about this. Now we just don't care and we just accept it. So we started focusing actually on trying to manage the safety and the compliance on the things that actually have risk. So what I'm now going to try to explain you in simple terms is actually how we try to frame the risk management within the company, how we're going to develop the AIs to make sure that actually focus our efforts in the ones that are risky and not in the ones that are not risky. So I'm going to give you a few examples. So as we were actually explaining to you, so we've been building several AIs for several purposes within our product, but also been using AIs from like Fireflies, like competitors of Talca, for instance, from note takers and so on. And not all AIs are important in our processes, are important for all users, but not all AIs have the same level of risk. So basically, we segment that level of risk that we have in each of our AIs. And based on that, we have more or less levels of control in how we let our AIs be more or less compliant. So just a couple of examples for you to understand. So imagine we have two copilots, one that we support physicians for scientific papers research, and one of them that actually support them for drug decision making, like dosages questions. So the first one is actually much lower risk than the second, because in the second one, if we fail, there could be a potential outcome of some patient being affected by that. So it's one of those cases that we need to be heavily regulated, we need to be a medical device, and we need to be really sure that if we miss, we are aware that we are missing. And I'm actually highlighting this because all AI is going to miss eventually. We just need to make sure that we are aware, and in case we miss, what happens. So actually, in the right base, we have like a brief explanation of how the process works. I'm going to try to walk you through like how it works in a more complex high-risk model. So in one of those, basically, we start with state of the art and what actually academic information we have on stage. And based on that, we define a series of tests. And by series of tests, actually, I mean a series of tests. For example, in this case that we're talking about, we have over 30 tests defined that actually try to measure different parts, and not just if the answer is right. Is this answer right? Is it complete enough? Is it relevant enough? Do we have bias on it? So is it consistent enough? So there are different angles that we can actually use to measure a response. And we're talking about text most of the time, so it can get more complex on how actually the model may be missing or not. And for example, we have, I'm going to just describe a situation, we may have some cases that we know that the model is not great at leading with some situations. That's fine, we just need to be aware of that, measure what is likely that it doesn't perform that great in those cases, and based on that, we can actually manage that risk. So for instance, after we perform the validations of all the models, we need to assess also the benefits of the tool itself, because at the end of the day, the tool needs to have value and provide value to the user, that in our case is a physician. And at the end, there should be still a part of the risk that needs to be accepted and managed, as I was saying. So in this case, for instance, it could just be something as simple as saying that I have a disclaimer explaining to the physician that in these types of use cases, the response may not be right. And this is precisely what we are saying about managing the risk and actually having something in place that we can support the physicians in being aware on when they can trust and when they actually should not trust a response that we are generating. So this is like in a nutshell how we are doing it. So there are some technical things involved specifically on how actually to design these validation processes. The one thing I would like to highlight is actually that we use actually physicians to validate how the model works and actually to assess if it is working well or not. We are about actually discussing on how to launch even a crowdsourcing in our own community to start using our own community as AI testers of our own AI developed by us. And this is all actually to make sure that we have something that is in place in the market that is safe. And even then, we need to make sure that we have post-market surveillance, that we are aware of how users are actually interacting with the tool, how they are feeling about them, what they report that is not working. So it is an everyday job, the full life cycle of not just developing, but also maintaining in the market these types of solutions. So just to wrap up this part on our governance framework, I would also highlight that one thing that we are definitely also now paying lots of attention, as you've seen, our engagement is booming. We are having physicians that we feel that are using heavily our AI solutions, is also making sure that they are aware that you should not over-rely on AI, especially when we are at a stage that we know in some cases it may miss. So AI over-reliance is definitely one of our key concerns. So moving fast, just briefly, we also are publishing some science on the accuracy of our own models. So quite interesting thing is that we know that right now AI models are actually getting much better with time. And this is actually the comparison of national exams being taken by our AI comparing to physicians. And our AI already is in the top 5–10% in most exams compared to the average physicians. So this is just to support on how good actually AI already is in clinical knowledge. So to wrap up the final part, I will just now move from the product part to the people and organization side. So with this process of actually building AI products, we also started to do the pivot of making sure that everyone is using AI in the company and making sure AI is in the forefront on how we're actually setting up the company to grow. So everyone is discussing and showing how everyone is using AI to support building code, to create content and everything. So we're also doing the same there. It's not going to be any different from any other companies. I will just highlight is that we have lots of early adopters that actually just do AI on their own, and we allow them and actually provide all the tools that they need to do it. But also we are doing some interesting tactics on getting into the people that are not resistant at first on AI. And for instance, we are now doing an internal challenge that every team needs to make an AI-generated video for user acquisition, because it's actually a challenge that we have right now. And we are forcing every team to build their own solution. So we also are using some tactics to make sure that we, in this shift from being AI-driven company, that we don't leave anyone behind, and even the ones that are not naturally attracted by this, that actually we support them in this. And I would like to close with one of the challenges that we've been facing most recently is actually not just on how AI is impacting the way that we work, because that is pretty much given at this stage, but how AI is impacting how we organize ourselves in a company, but it would probably be the same in any type of organization. So just two very quick stories. So one of our backend developers came to us a few weeks ago and said, I want to move to AI. I want to do AI development. And in the same week, one of our AI developers basically started doing some front-end development and said that, well, I want to do some front-end development for a few weeks. And so this is starting in the tech team, but probably in a few months or years, this will always also go back to the rest of the teams, is that AI is removing the silos from hard skills. And maybe we need to start thinking about how we organize people in teams based on hard skills, maybe something that also could be questioned with AI. So we are also already doing some things in this aspect. Some of the things I don't really have an answer right now, but we're going actually to start piloting some of these ideas. But we are going to start, let's call it, de-specializing some of the roles within the company in a conscious way, because it may be fine to have an AI developer doing some front-end for a couple of months, and maybe fine having a back-end doing some AI in a couple of months, because with AI, it's much easier to do this type of shifts that before AI will take months of onboarding and training to be ready to do those different type of role. Also, this is changing heavily the way that we recruit people. As you can imagine, recruiting for hard skills is much less relevant for us right now, and we are actually focusing a lot more in making sure that the people that are joining are AI enabled, they are AI curious, and they are adaptable in what we may need, and also to change as an organization. So, to wrap up, what we are feeling from standing at the side of putting a product in the market that actually is supporting physicians with Gen AI is that we have no doubt with data that so far that the adoption is coming, and it's coming fast. And there are like two different models, like the Centaur model and the Cyborg model. Like either the machine replaces us in the Cyborg model, or the machine empowers us in the Centaur model. So we believe probably for now most of medicine roles will be assisted by AI in a very short time period of time, and that's basically what we are seeing. So just stressing that safe medicine and being responsible and how we develop AI in healthcare is definitely something that it's a core in how we are actually addressing AI, and we believe that definitely going to be one of our competitive advantages in the future, also accounting for this. So, as I was saying, pivoting not only as an AI company, not as an AI product company, but also as an AI company itself, is bringing new challenges, but also bringing lots of learnings on how we can improve and how we can actually build the team going forward. So, what's next for us? New markets, new things coming up, but definitely just a few. We're now just moving into the agents part and how it's going to change the way that we are automatizing most of our internal processes. Automatic content generation and lots of personalization on our AIs are definitely the most interesting topics for us moving forward. And of course, keep empowering our workforce. And that's it. Thank you.